Hi, my name is Katie Owens. As the president and co-founder of the Healthcare Experience Foundation, I have the amazing opportunity to represent a team whose firm conviction and belief is that every person is worthy of an environment where they can deliver and receive the best healthcare experience. Our team has had the opportunity to work with hospitals and health systems across the country. Now more than ever before, we want to support you, senior leadership teams, in responding to this unprecedented, uncharted course that we're currently facing with crisis communication, in particular associated with COVID-19. So we've pulled together 3 big objectives to share briefly with you. Let's face the crisis reality. Let's talk about 3 practical strategies for you with communication, visibility, and rounding, and then close with 3 steps you can take. So let's go. This is just a small snapshot of our current crisis reality. Everywhere you look, there's news headlines, empty store shelves. A time just 3 weeks ago, we remembered having easy access to toilet paper. Some memes that, despite its seriousness, almost make us smile. Plus, all of the things hitting not just us as leaders, but our employees, our physicians, and our patients. Closures, restrictions, the market, cancellations at every turn. Do we go on a cruise? Don't go on a cruise. Daily changing protocols, shortages, preparation variability. Just in the few weeks, we've seen many hospitals and health systems respond very differently. So that means if you have employees or physicians that practice in other organizations, they have a little bit of whiplash. And changing perceptions. Things that felt safe to us and to our patients, or clean or not clean, have changed overnight. So what can we do about it? Kathleen Lynham on our team famously says, when people hear, they cannot fear. So as a senior team, your visibility, your presence matter more than ever before. The challenge is, and sometimes as coaches, we have to deliver the good and the challenging news. We see our intent. And many times our intent isn't always viewed the same way by our employees. So we want to focus on that it's all about relationships in any crisis, in particular right now. How executive teams foster confidence and trust through communication, visibility, and rounding will pay dividends for you in the culture and climate you're trying to create. So with communication, we want to handle it with care. Perspective is everything. We don't see things as they are, we see them as we are. And all of those factors that I shared with you a moment ago, they're hitting everyone very differently because of perspective and context. And reality can be so complex that equally valid and meaningful observations can be contradictory and different. We see our intent, employees see, where are we? Do they trust us? Do they see us? Do they feel like we're with them right now? So real quick, perceptions are shaped with 3 big categories: direct observations and experience, what I see and feel, word of mouth, and social media, and the opinions shared by employees who work here. And in the absence of information, individuals create their own stories and interpretations. So as a senior team, we really recommend that you focus on, do we even know the starting point, and are we even in the same place? So we want to help you avoid 7 common pitfalls that we see during crises like this. Assuming employees know. You are in many meetings, you are getting minute-by-minute briefings many times. You as a senior team are talking about how important this is to you to support your employees. Don't assume employees know what's happening behind the curtain or around the conference room table or conference line. Failing to share or not take credit for all that you are doing right now. Assuming managers and directors are accurately and with your right tone and inflection and desire sharing the information. Not sharing the stories, the good and the challenging ones. Focusing only on the negative. If every time an employee sees you or hears about what we're not doing according to this new changing protocol, the negative psychology of that can be detrimental to your culture. Not having open forums or virtual open forums for conversation or texting lines. Assuming a policy update addresses anxiety. And here's why the policy updates are critical. Yet when people have anxiety, only 7% of what they hear are the words coming out of your mouth. The remaining 93% is split between tone of voice and body language, and that can't be conveyed simply through written updates or email communications. People have to see your intent. So let's talk briefly about visibility. These are all things we know, but really need to remind ourselves in times like this when we are so busy and overtaxed. Being present at the start time for huddles is an entire senior team, not just nursing, not just CMO, CFO, HR, CEOs, information officers. The whole team should take turns being present, especially during peak times, during off shifts. So some do's and don'ts. Do explain the why. Ask employees what excellence looks like to them. Share the stories of excellence, the times when staff members are just going above and beyond, being willing to take on everything and anything. Do listen without defense. We can absorb, we can take note, and we can follow up. We don't need to debate. Ask open-ended questions. They will get you much richer feedback as a senior team from your front lines. Share your commitment that their voice matters and express gratitude. Don't blame or ask staff or physicians why they're anxious or angry, or deflect their perspective. Focus only on the negative. Defend or defute their perspective. It's not about a right or wrong. It's about shared understanding. Don't avoid being visible during the difficult times. Let's get comfortable with the discomfort. Don't avoid, if you're in a non-clinical area, being present and visible in care environments. Fail to share the successes or opportunities, and be afraid to show vulnerability. None of us know all the answers right now. We're doing the best we can with what we have where we're at. It's okay to be vulnerable. Rounding. Performing with this right now is about a team-based approach with every member on your executive team. It applies to all departments. We're rounding in the ED, we're rounding in the waiting rooms with registration, we're rounding in the OR, we're on the units. The CFO is going to the ICU like nursing is going to registration. We're sharing planned messages and inquiry, and our goal is listening, understanding, trust, and action. And remember that ratio. Words carry weight, but not as much as being able to see and feel the senior team's commitment and trust. So some simple guidelines to build your message. Be able to explain headlines. What are the top takeaways you want people to remember? Explain the why. Why is this important? Why are we doing this? The how. Describe what success will look like right now, even if that's changing. And enlist and bring people along with you. Be specific about what you're asking people to do. Here's an example from a recent organization. We know this pandemic has created challenges, fears, and safety concerns here at home and in the world. We are committed to being more present, sharing what we know, and listening to what you are seeing and hearing. We will be stronger for this challenge. And we know if we keep supporting each other and listening to each other and providing the excellent care we always have, we will get through this. I need to ask for your vigilance, helping us see any blind spots, sharing concerns, and sharing the success stories. We've included 6 questions to ask, asking things about what they're proud of with their preparation. They are doing so much to be ready and to respond. Can you share with me a time when you felt administration did a good job recently responding to any concerns? Are there times when we've disappointed you? What informs your perception of patient safety? What stories do you have that you think we ought to be aware of that patients are saying about their experience? You can also add that. Can you share examples of times when we could have communicated or shared information better? And what can we do to support you right now? And we've highlighted these areas because you can kind of drop in different things based on the focus that you need in that moment for that particular crisis. And then we want to connect the dots. We've listened. Here's what we've worked on and what we need to do next. And because we've said that this is so important as a team-based approach, Take the time during your senior team briefings and huddles to share what each one of you are learning and to be agile as a senior team. So to wrap up, our third objective, some steps you can take. Understand the perspective and the changing perceptions of your workforce, your physicians, and your patients. Be intentional to build that internal communication and points so that you as a senior team can respond consistently. Plan for the entire senior team to be visible and rounding. Follow up with what you've heard. Practice for the tough questions and be reflective as a senior team. What are we learning together? How are we growing stronger? What do we want to be better at next time? While we certainly do not have a crystal ball for how COVID is going to unfold or any future circumstances, what myself and our team can commit to you is by following these 3 simple strategies, you will be prepared now and in the future. Thank you for the opportunity to serve you.